You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories.
And welcome to episode 350. And in this one, I got on Charlene Colwell. Charlene is a therapist who uses internal family systems and exposure and response prevention therapy together for OCD. And in this episode, we talk about her therapy story, her own OCD journey, what is internal family systems therapy, how internal family systems therapy maps the mind, what are some of the ways internal family systems therapy can be helpful for OCD, as well as looking at a reframe of how to look at OCD, how it's possible to integrate ERP, or exposure and response prevention therapy, with internal family systems therapy, and so much more. And thank you to NoCD for supporting the podcast. NoCD offers effective and convenient therapy available in the US and outside the US. To find out more about NoCD, their therapy plans, if they currently take your insurance, or to download their free app, head to go.treatmyocd.com/the OCD stories, or the link will be in the episode description. And thank you as always to you guys for listening. I deeply appreciate it. And of course, thank you to Charlene for her time and her knowledge. So without further ado, here she is. Welcome to the show, Charlene.
Good to be here. Thanks for having me on.
It's good
I'm
to have
excited
you.
to talk about some things today. So yeah.
Absolutely. And of course, in a minute, we'll get into it, internal family systems and exposure and response prevention therapy, living together side by side. And obviously, we've covered IFS before on the podcast with Rob Fox, but that was IFS as a standalone. Here, we'll be talking more integrated. But before that, it'd be good to hear your therapy story. So what got you into being a therapist and specifically OCD?
Yeah, I think getting into being a therapist, I feel like it's a similar story to a lot of therapists where, I don't know, it just kind of feels like you're a person who listens well and people respond to that. And so I just kind of noticed that about myself and really having a big curiosity in my own self about our mind and the brain and how does it work. And I think that's kind of what pulled me into the therapy world, and really just wanting to help others. And working with OCD and like getting into that kind of field, I would say I noticed in grad school, I just kind of gravitated towards, in one of my CBT courses, we had to do like special projects on certain topics and more information on that. And I just like gravitated towards OCD for some reason. That was very fascinating to me. And I would say, in that process, I started to notice a couple symptoms in my own self. I'm like, oh gosh, I do that too. And I know that happens a lot in grad school, but it really felt real. I was like, okay, I feel like I have some traits of OCD or something. So I kept calling it that throughout that time. So I had this interest in grad school. And I guess as grad school progressed, my traits of OCD got a little bit more intense, is what I'll say. And and then I became a therapist, and I still was struggling with these OCD traits, as I called them. And there was just a point where it got significantly worse, as OCD does. It progresses, and I would say, I sought out therapy, and I guess I'm kind of talking side by side here. I was also treating OCD during this time too, and it's been trained in exposure and response prevention, but hadn't done it for myself yet either. But I was definitely like utilizing that in therapy with people, and because I just still had that interest. So I kept seeing more and more people with this diagnosis, because I think a lot of my colleagues knew that I worked with that, and so they would just send more people my way. But yes, along that path, I was doing my own work at the same time. I started to do exposure and response prevention therapy, which was actually super helpful. And I think it really reduce the symptoms like extremely significantly. Let's see. Yeah, I don't want to get lost in my story here, but I guess I'll say also, after exposure and response prevention therapy, really helpful. I also still noticed like nagging symptoms that just kind of persisted. And I had also along the way discovered IFS, this IFS therapy, and been utilizing that as well, in my own life and then also in therapy. And so I decided I was going to seek out some more like IFS consultation, it was similar to just really working on your own stuff anyways. And so I saw that there was such a great benefit with just going a little deeper than exposure response prevention brings us, I think. And there was just a lot more relief that came even from that kind of added step of IFS, I guess, with my OCD symptoms. And yeah, and I guess from there, I've seen the same thing happen with people that I've been working with, trying to integrate both of them. Sometimes they feel opposed, but they definitely, I think, can go together.
Yeah, look, thank you so much for sharing, your story and opening up about your own sort of mental health. You're right, and I think that's why, I was trained as an integrative counselor and psychotherapist, so I'm passionate about integrating therapies because they're not always going to be great necessarily standalone, and we know ERP is wonderful for many people, but it's not perfect. And that's why we need to look at other therapies in unison with it. So, I'm not IFS trained, but it is something that interests me, which is why I've done some episodes on it.
Appreciate that.
Yeah, no worries. So, let's start. So, I mean, some people listening to this would have heard IFS, the episode I've done. I've done 2 now, actually. But many may not have heard those. And even those that have heard it, maybe could do with a refresher. So what do we mean by IFS?
Yeah, it's always a loaded question. But I will try to be succinct and you can pause me at any moment. And thinking about what is IFS, I guess some things come to mind is what is IFS? What's the purpose of what we're doing in IFS as well? And I guess the other thing about when I'm answering that question is really like, what's the perspective that the IFS holds about our mind, I guess, and like how it views our symptoms, our experiences. So I would say IFS therapy is really like a process that helps you build more inner connection and compassion to yourself and the various parts of yourself. And through this inner relationship, you kind of develop this way of being like a compassionate guide to these different parts of yourself that feel stuck or in unhealthy states. And so, I think that's what I would say. It's really like a way of developing a better connection with yourself. That's the simple version of it.
Yeah.
And
would you say it's about like uniting those parts? So if we go back all the way to like early psychoanalysis and stuff, and we talk about splitting and, different parts and being fragmented and trying to merge that back together, is it kind of similar to that, or do the parts remain separate, but they're healed, so to speak?
Yeah, it's more of the latter, the second thing you expressed. At least from the IFS perspective and my own interpretation of the IFS perspective. But there's this idea that we're born with these different parts of ourselves. And of course, as we develop, they kind of like come online, so to speak, as our brain's developing. But they're really like just parts of ourselves that are already there and part of our humanity. And that our brain naturally functions in a multiplicity way. Like it really is a natural thing that we all have different aspects to who we are, different sides of ourselves that come out at different times. Yeah. So I would say as far as the goal, it's not necessarily to integrate those parts together. in the sense that those parts of you disappear, but it's to integrate those parts together so they're all kind of working in harmony.
Okay.
And so it feels like you're more whole and more like one in a sense. But it's like because there's such unity going on inside, it just feels so it's just more calm and peaceful when there's less inner tension going on between these different parts of ourselves.
Yeah,
Did that answer the
it
question?
did, it did. And what came to my head is like if we think of countries who may be at war
Yeah.
and then they find peace and then they get on for
Hmm.
50 years before they fall out again. But you
Yes.
know,
Yeah.
it's kind of like that. They've got that unity.
Hmm.
They're not, yeah, warring anymore.
Right. Yeah. And there's like more of an understanding between the countries.
Yeah,
Yeah.
yeah.
Um,
Okay, nice.
yeah.
That's it. Yeah, understanding. Yeah, you're right. Um, okay, so yeah, I guess before we go on to like merging ERP and IFS, how
Yeah.
do you think IFS can be helpful for OCD?
Mm, yes. Okay. I kind of want to talk a little bit, if it's okay, maybe before I answer that question, a little bit more. I know you kind of have had a little talk about like how does IFS see the mind, but I would like to
Mm,
just kind of review that again, if
yeah,
that's
please.
okay.
Yeah, go for
And
it.
then I think that'll help me answer that question. Um, okay, so so yes, IFS holds this perspective that we have these different parts of ourselves. They also talk about this like core essence to who we are, which in IFS they call that your like self. And it's so it can be confusing because sometimes we talk about parts as being selves. But really IFS to distinguish them, it's parts, and then we also have a core self, which our core self is kind of like this well of calm or compassion inside of us. It's like the essence of who we are deep down, and it holds lots of good qualities that will be very useful for helping these other things that we experience. So we have this idea of ourself and then these parts, right, which don't necessarily unify as far as like going away. They just start to harmonize more. But what can happen if things feel off kilter um, is that, yes, we have parts more like in conflict with each other. Um, or there's just more like tension going on inside. And I guess what I want to express here is these parts from the IFS perspective tend to fall into like a couple different categories. And to kind of make it really simple, essentially, we notice that certain parts of people will hold certain things like emotional pain or vulnerability, or maybe certain parts based on experiences in our life. We've taken on different negative beliefs about ourselves or the world. Um, yeah, or just holding painful memories. And so, because that stuff is so painful, we don't usually want that at the surface of our mind. And so we have other parts of us that have developed what I would like to say are more like adaptive strategies to like deal with that emotional pain. And from the IFS perspective, we really see that there's kind of two different strategies maybe that we use to deal with the emotional stuff that may not even be in our awareness, to be honest, because we have protective parts of us that like shove it down really good. Um, and so these parts that do this adaptive like protection work do it in two different ways as far as the function. One way is preventing any of that pain from coming up again. So it's more preventative. The mindset of the person is very like, okay, let's make sure that never happens again because that was really painful. And so this can start to look like, you know, anything that a person will do to try to just keep everything under control. Make sure you never feel that painful feeling or that vulnerability again. And of course, that's going to look different for every person.
Mm.
But it's really about like, how is it functioning for them? Is it working to try to prevent some kind of vulnerability from coming up? you've probably heard before that we kind of call those manager parts, which is like managing your life, trying to like keep everything at bay. But I like to think of them more as also like preventative. The mindset is very, let's prevent things, anything bad from happening, you know? And so because life is vulnerable and it does trigger our pain, we also have developed other parts of ourself that IFS kind of puts in another category of adaptive protective responses. And that is something they call firefighters, kind of like a nickname for those parts. And these are just parts of ourself that you can think of them as more reactive. They react to if something does get triggered, comes to the surface of our mind. They're reacting really fast to that. I like to think of firefighters as more of like soothers or distractors. They're parts of us that take us out of that the emotional flames, so to speak, the emotional pain of that experience. So it's like emergency response, like let's get you out of there as fast as possible. These parts of us don't really think about our future that much. They're not like, oh, let's keep your life under control. They're more like, let's get that pain out as fast as possible, get you out of the pain. And so it can look a lot more like our more, maybe the habits that we don't like, or just things that we don't necessarily like. We usually are wanting to change. So it could be like, oh, I spent too much time on the internet, or it can go really more intense and be in the realm of like suicidal thoughts, or, self-harm, using alcohol, drugs, things like that. But it is the aim of that part of a person is really to try to help them alleviate the emotional pain that may have gotten triggered by a certain situation. Of course, like everyone's parts are different. So you could have like a person who has maybe alcohol addiction, and that would be if they're repetitively doing that and they're always staying in a state of alleviating the emotions or the painful emotions, that would fall more into like a manager part of a person, because it's kind of consistently the function of it is to keep everything down versus just respond to some kind of emotional pain that got triggered. So I guess like using drugs or alcohol isn't always like in this firefighter realm, but we're just looking at the function again. So like, is it preventative or is it reacting to something and trying to get you out of that pain to soothe or just distract you? Okay. So with that, like we have parts that prevent things. They're trying to protect that pain. Parts that react, also trying to soothe and protect that pain. All the while you kind of stay stuck in those, like in that cycle. And then that pain never gets touched or helped. And so I guess what I'll say is that IFS helps a person get space from those like internal reactions so that you can start to work with the pain that's there. But a lot of the work is actually with those protective responses first, and just being like, hey, brain, or this part of me, there's other options here. Like we don't have to keep responding in the same way that you maybe initially took on. So I'm going to pause there. If there was any other questions. I kind of forgot your other question. So
no, I guess what came to my mind is with, and I mentioned this to Rob when he was on, I can't remember what Rob said, but I mean, managers are preventative and firefighters are reactionary.
Yep.
And in my mind, OCD is both of those things. So with OCD, could it be in both of those categories?
I think so. I've seen it in all of the categories. Okay. Yeah. So it really just depends on the person. And that's why like exploring this with someone, it might be very helpful. Like, oh, what is that part of you trying to do? And so you get a response when you're doing this therapy, you get more awareness around that. But I would say I've seen it where like you could maybe say the obsessive thoughts or intrusive thoughts would fall more into this like manager, like trying to prevent stuff. It doesn't feel like that, but it really is. It's like these what ifs of like, oh my gosh, what if that happens? What if this happens? It's trying to predict the future. and prevent anything bad from happening. But there's so much distress caused by those thoughts. And it actually does kind of trigger sometimes the part of a person that might be in that pain already. But it also triggers this, maybe what we would say the firefighter or reactive part, because it's responding to the scary, intrusive thoughts that the manager part of a person's like bringing up. So it's like, let's douse that out. Let's get rid of the distress that you're bringing up inside, Yeah. And so then there is kind of this like, yep, it really is a tension inside where someone's having these scary, intrusive thoughts. And then this other part of you or a person is trying to like really manage that or really like react to that when it comes up. So yeah, I kind of like to say that they do fall into a little bit, like the obsessions fall in a little bit more of the preventative or intrusive thoughts, and then the compulsions are like trying to deal with that anxious distress, but it's more reactive. Like I would say sometimes compulsions probably can fall into that other category if you think about it. Like over time, it sometimes could be like, well, now I'm just going to like try to prevent these distressing thoughts from coming up, and so it's thinking more ahead.
Yeah.
So it can fall into that again.
Yeah.
Or at that time.
Yeah, thank you. That's useful. So people are probably wondering, okay, this is great, but how is this going to help my OCD?
Right. Yeah, that's right. Okay, so that question about what are ways IFS therapy can help with OCD. Yes. Okay, so I'll talk about that, and then maybe we can try to talk about a little bit of that integration.
Yeah.
Yeah, let me think here for a second. I would say one of the primary ways that that IFS therapy can help a person suffering from OCD, and I would say even from an IFS perspective, we would say maybe parts of a person that are stuck in an OCD cycle. It's really, I think it really offers a massive reframe of how a person's seeing or relating to their OCD symptoms. So I think that's like one of the biggest things that can kind of come in. And I guess with that, with the reframe, I guess, how does that happen? So I know Rob talked about this a little bit, like the positive intention of our parts. So if our parts are really kind of stuck in these roles of like protection, and you discover that when you do start to explore OCD symptoms, if that's the case, that means that these parts of ourselves actually have really a good intention to try to help. And it's maybe something that a part of a person learned at some point, like, oh, this was helpful maybe at some point. It's just that the brain actually does get stuck with the original like emotional learning that it took on in certain situations. So just seeing that already as just a different way to view OCD as this part of a person that's actually really trying very hard to help, but it's backfiring, and then those parts of a person can't get out of that cycle or don't feel like they can. There was something else that I had in mind with that. I think so. I'm going to say more about that probably in a little bit, but the other piece that I think is helpful is just even the idea of OCD being a part of a person versus all of a person. Even like utilizing that when it comes up in the mind too, when you're noticing these symptoms, like, oh gosh, okay, there's this part of me that's doing this, and it actually helps you already by acknowledging that to separate from it a little bit and be more in that like mindful observing state with it. And if you are able to separate from those feelings inside, which IFS helps you like do that, there's like a technique that we talk about with that. But if you are able to separate from those parts, or the OCD parts at that moment, then that does open up that space, and now you're relating with it. And you can relate with those parts from sometimes another place inside of you, or you can relate with those parts from what we call your core self, which is that compassionate place. So it just at least opens up the opportunity for you to bring in something else. So it's not just you hijacked by OCD, is what we'll say. Yeah. Okay. So what are ways IFS therapy can be helpful with OCD? I'm just still thinking about that question. Any other, I don't know, follow-up questions with that, or?
I guess, yeah, I think the reframe could be helpful. I know sometimes there's pushback by people who want to see OCD as this bully, as this separate entity that's being a douchebag.
Right.
And it obviously it feels like that, right? And that's very much how I saw it for many, many years.
Absolutely.
But yeah, I reframe with my clients similar to this in that I'll bring it back to sort of neuroscience, so to speak, of like it's your downstairs brain, just it's triggered for some reason and it's trying to protect you. And our job is to kind of show it doesn't need to be afraid, maybe care for it, show it compassion, whatever we need. Yeah, and that, it's just to try to take away. It's not trying to hurt you. It's actually trying to help you. It's just not helping you in a very effective way. And it's actually making your life harder. So I found that reframe. And to be fair, none of my clients have pushed back against that. And I always offer, if you want to, call it a bully, we can use that, I'm not against it. I think this way is better. But I know, and obviously if you're really in it, and it's early days or you don't have therapy, I understand why you'd stick to the bully term. It makes sense. And I used it for a while.
Yeah, definitely. I think I did too. I think that's another piece that it is hard for me to go that direction anymore, is like saying OCD is a bully or like a monster. But it is what it feels like. And actually certain parts of a person are going to have that perspective. And that's okay. I think IFS can help with, in a sense, getting internal space from even the parts that view OCD in a really intense way, so that you can reach that place of compassion and openness and go, oh, okay, there's more going on here with this part of me. Yeah. There was something else with that. I'm trying to think. Because I don't know if I fully answered the question. Go ahead. Yeah.
Yeah, I was just I'll jump in. Well, I'll give you more time to think.
Sure.
And I've said this years ago, I think, on the podcast. My therapist, who I've seen for many years now, she's not an OCD therapist, but I wasn't seeing her for OCD. I was seeing her for other things. And I also had to see her as part of my training. We had to do weekly therapy. And she would say that she said to me in the first sort of few months of working with her, I think it was the first few months, that she felt like OCD was my way of coping with a difficult situation. It was my way of managing. She used the word managing, but that's how it came to me. Stuff that I couldn't handle at the time, I couldn't process, and it was my way of getting control over situations I had no control. And I didn't get annoyed by that, but I was a bit like, that's rubbish. In my head, I kind of, that's nonsense, Yeah. And then sort of 5 years later, I was like, no, I think she's onto something. At least for me as an individual, onto something. Yeah.
Yeah. Right. I'm by no means asking everyone to take on this perspective. I just feel like it's been very useful for a lot of people that I've seen anyways, and for myself. And I was actually kind of thinking of this kind of connection with Dr. Michael Greenberg's talks. I've heard some of his talk about the core fear and how OCD is this protective strategy. And I'm like, yes, that's kind of the perspective that IFS would hold as well. That it's just really this coping adaptive strategy that the brain has learned to do. At some point, we may not always identify exactly where did this begin? But sometimes that does happen. We do have some specific things that it's related to, and I'll share an analogy here actually, which might start to illustrate a little bit of maybe how the relationship can be a little different with like the inner connection that you have with OCD can be a little different with IFS. The example that I like to use a lot is thinking of if you thought of OCD as a person, and it came into the room and sat down with you, and you asked yourself, well, like how would you feel towards that person sitting there with you? And a lot of people will be like, I hate it. I think it's a monster. I want to avoid it. Or there's also maybe parts of a person that feel scared of the OCD. Parts of a person that are just exhausted, parts of a person that are angry at it. So you have lots of these like internal reactions towards the experience that, when parts are in an experience of OCD. And that actually is just, so thinking of that analogy, that's revealing like different parts of a person that kind of come up and get activated around OCD. And often that just stays in that cycle of like, I hate it every time it comes up. And then it's just like, I want to avoid it. And I think if you ask the question, in keeping with that analogy, if you have all those reactions, but let's say you had some space from the anger, the tiredness, the avoidance, the fear. I guess before I say that, I would say, if you are feeling all those feelings, do you feel like that person, the person who's embodying OCD, do you feel like they would feel open to tell you why they're doing what they're doing? Like, would they feel open with you if you're just across from them being like, I hate you, I'm angry, I don't like you, I want you to go away? Like, that probably maybe wouldn't help the person embodying OCD at that point feel open to like sharing its story with you. And so like in IFS therapy, what we're doing is helping a person get space from those inner responses, which those feelings don't need to go away. It's more of just like softening a little bit so you can get into a place of curiosity. So if you're now sitting across from this person, being curious about them, showing compassion and like, what is going on with you and your experience, they might be more willing to share a little bit more. And that's kind of almost like what happens in the brain when you're doing IFS therapy is it's like, wow, when all of those other feelings soften, it puts you in a mindful place of being open to hearing and noticing more about it than you would have if you're just staying in the state of anger or frustration with something. That kind of makes sense.
It makes a lot of sense. Yeah.
Yeah. I like to do the personal actual analogy because it really is OCD. You can think of it like it's a person in your head. I know that sounds different, but it's attached to your personhood. That's kind of how I like to say it's like it's part of your brain and you're a person. So if you think of it like relationally, it really does start to help, I think.
Yeah, it's interesting. Yeah. So when my mind started to change, I stopped viewing it as this monster or this bully. Mm-hmm. And the image that came to my mind was that it was a small, scared child.
Yes.
And
yeah.
Yeah. And it's much, I can deal with a small, scared child. Mm-hmm. I can't deal with a monster. That's too powerful for me to handle.
Yeah. Right.
But a small, scared child I can work with. So it made it easier, I think, for me.
Yeah, definitely. And I think that's often what comes in IFS therapy is like, yeah, usually these are young adaptive strategies that we've taken on somewhere. And yeah, these parts of us are just doing the best that they can with maybe what they knew to do at the time that they started doing what they do. And yes, it is much easier to I also like IFS in the sense that it helps you have a gentler approach. So if you're now viewing OCD as this part of a person that's just trying their best to help you with some kind of pain or something that it fears, you can bring in more compassion and gentleness, really like how would a parent kind of guide a child? You definitely wouldn't be doing a lot of the things that maybe we think of in regards to like thinking of OCD as a monster. Like it just really changes the perspective and the relationship.
Yeah. I mean, there's tons more I can say on that, but I think
I know there's a lot. Me too. Yeah.
So Before we go on to merging, is there anything else you want to say on IFS for OCD?
Let's see. I have a couple notes here that I had. I think we went over most of them. Just like the main thing there is like, I feel like it reduces tension inside between these, like maybe the obsessions and the compulsions. And seeing that as protective strategies, and it increases a better relationship, from yourself with those parts of you, leads to more space. um yeah, and I think so this might lead into the next question, but I think it's having more of that space does start to allow you to be able to do some of these exposures really from a different mindset, maybe. So yeah, I don't think there's anything more about that I was going to share. I'm sure there is more, but I'm not. we have a certain amount of time, so
yeah, that's okay.
Yeah.
So yeah, I guess the big question for me is, what does merging or using the two in combination look like?
Yeah. Oh, I did just see one thing. So one other thought, follow up from the last question, and then I'll go into that. Yeah, I guess the other little point that I wanted to put out here is that when you get into that place inside yourself where you do have that compassion just naturally, you're not forcing it, it really, you can actually, and this is how we'll start to talk about ERP a little bit, you can offer that compassion towards this OCD inside. And I think it's really soothing and comforting for those parts of us that are scared. And it's doing it, I think, in a non-compulsive way. So you're not engaging in the compulsions, but you're offering that relational connection inside of yourself, just like a loved one would be doing for you and encouraging you to like do an exposure or like face your fears, So that's one piece that I wanted to share with that.
Thank you.
But yeah, going to that question, ERP and IFS, I would say I haven't like developed like a standard protocol for integrating them both. So I kind of organically mix the two. It's based on the person. So I'll say kind of what I see happen and then maybe a couple of ways that we can integrate it. So often I'm either starting with IFS. Sometimes people come in and they want to do IFS and they're interested in that because they know I do that. And sometimes we'll start with that, and then once they're kind of along the way in that process, there might be things that will integrate from exposure. Sometimes it's not like a full exposure hierarchy. It might be like exposure skills, maybe I'll say, like a mindset that you might take on when you're bumping up against things that what are those on the fly exposures, I think is what I've heard them described as. Okay, so yeah, sometimes we'll start with IFS and then start integrating exposures once there's been enough maybe space from OCD to be able to start doing that. Sometimes I'll solely do IFS with OCD symptoms if someone has decided they really don't want to do the exposure route. And that still really, there can be some resolution of symptoms in that, even without the ERP, which I know maybe will be alarming for some people, but so those are a couple options. Another thing that I see too is that sometimes people will want to start with the exposures. And I also think it might be helpful to start there, even without like a ton of inner calm or space there, because I think exposure reduces the symptoms enough sometimes for a person to really like start to feel more separate from their OCD. And so I think it's almost like another route to getting that space from OCD is, I think exposure therapy really can do that. So yeah, those are kind of like the ways that I mix it in, but let me kind of think about what things I want to point out on that. Or did you have any questions too?
No, I'm happy for you to continue. Yeah.
Okay. Yeah, I mean, so I kind of started talking about this a little bit. So sometimes I will develop like an exposure hierarchy with someone. And I usually present both options actually. So exposure response prevention, it's like standard gold treatment for OCD. A lot of the research supporting this. It is helpful. So I'm never like knocking ERP at all. And then I also kind of present IFS a little bit and say, this is just another approach I've found to be really helpful to going a little deeper than what we can get from exposure therapy, which is a little bit more, I would say, behavioral, and not really looking at the why. And maybe that's, again, maybe some people disagree with that, and that's okay. But I really think there's purpose in a lot of our symptoms. That's just my perspective. So yeah, I offer those. People kind of pick one or the other or both. If they pick both, I would say I like to start, if they're open to it, with exposure, like setting up an exposure hierarchy, and maybe even having them start doing those exposures. And then, the work of when they're in therapy, we're doing IFS therapy. And then outside of therapy, they're definitely still engaging in those exposures, but also starting to develop this like different mindset with their OCD symptoms. So taking on that idea of like, oh, this is just like a protective strategy. It's trying to help me right now. And like almost like acknowledging that. So they can develop a practice of acknowledging, really appreciating the fact that this part of ourselves is helping us. And then kind of going into, for exposures, almost like negotiating with it, like, well, but can we try? Can we try to like do a little bit of this, facing this fear? And let's just see how that is. And then I'm almost like helping the person can then like check back in with that part of them. Like, how was that? Kind of a little inner dialogue. There's a lot of inner dialogue that goes along with IFS, but I think that's just like a nice way that people can start to incorporate that. So they're doing exposures, they're learning in therapy more about bringing more curiosity to this OCD. And yeah, I'll pause that for a second if there was any thoughts you had.
No, I think that made sense. No, yeah, I don't think I have any questions on that.
Okay. Yeah, I have a couple other thoughts that I'm gonna maybe attend to. We'll see. Yeah, and then I would say if someone's wanting to just do IFS, and then, or at least start with IFS and then integrate ERP. I think I might have already said that, but it's really about like working on shifting this mindset, developing a different relationship with these OCD symptoms, being more curious about it, asking some inner questions to see like what kind of comes up, about what is the purpose of this, how is this trying to help me? And I think it almost just naturally goes into a place sometimes of doing more exposures in everyday life, just by starting to like notice different things or have more understanding with the OCD symptoms. But we will still, set up specific exposures. I think with integrating this, I think the mindset is probably a little bit closer to Dr. Michael Greenberg's approach, which I think is a little bit more, I think I remember him talking about how like it's not about making yourself more anxious. It's okay, you can do exposures even when you're not anxious, and that's still helping your brain learn. And so I kind of do take that like learning approach perspective. And so it's like you could be really calm and do an exposure, but your brain's still learning that this part of you or the compulsive part of your brain is still learning that it actually doesn't need to do that. And there's actually another resource inside, which is yourself, that actually can help you through all these things in your life that maybe didn't feel very present when these parts of a person started acting in this way, Yeah.
I guess just to jump in there,
Sure. Yeah.
with your clients that come to you and say, actually, I don't want to do ERP, even though you've
Hmm.
explained it to them and how it's
Yeah.
safe and it's fine and blah, blah, blah. They
Hmm.
still don't want to do it. And, I've had clients like this.
Yeah.
And it's like, oh, come on, do it because
Yeah.
it could help.
It'll
Like,
help.
let's try it. When you've done some IFS with them, do some of them change their mind? Because now that they've got the reframe, that ERP becomes less scary or not?
Hmm. Yeah, I would say so because I think the process of IFS is really about almost like connecting these scared parts to this really strong, confident place inside. And that already just starts shifting like how a person's even being in the world, you know?
Yeah.
So, yeah. I mean, it just becomes more like traditional IFS therapy. And I would say something I haven't shared about that is kind of the whole one of the main goals of IFS too is really helping parts of us that maybe have taken on emotional burdens to actually unburden that. And what we
Mm.
find when that happens for people is that the protective response or strategies actually like become aware almost it's like these two parts of your brain become aware of the information together. It's like, oh, okay, that pain's not there anymore, so that means I don't have to keep doing the same thing to protect it.
Mm.
And so there is kind of like an integration of like information and new learning, I would say, that kind of comes in to this part of the brain. And then what happens is you start to notice that protective strategy starts to relax and it doesn't feel the need to do it as much, which means the OCD symptoms start to dissipate.
Mm.
Not saying it disappears forever, of course, but it's going to often feel more relaxed and not as intense. And that'll just grow, I think, over time. Which I think that same thing can happen in exposure and response prevention. It's really, if the brain is really learning new things, it kind of learns that same thing. But I don't know if the core pain gets unburdened in the same way with exposures. Um, but the protective strategies learn a little bit more. Yeah.
Yeah, yeah, no, I agree. And I'm thinking obviously there's going to be some therapists who are obviously completely behavioral. They may be
Yeah.
thinking there's nothing that needs to be unburdened. That's the challenge they'd push back with.
Yeah.
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 I guess we'll
I
never
would,
know.
yeah, right. And I
Yeah.
would say, like, it maybe doesn't always mean that something needs to be unburdened.
Mm.
It's often the case, is what we find when there's symptoms, because it reveals like protective strategies that are like overworking and being really intense. But I mean, I personally wouldn't say like, oh, like, because I don't know. I don't know everything. It's more of just being curious and seeing what it is for that person. And if we often find that there is something to unburden, but it doesn't necessarily mean that that's the case. Sometimes it's like purely biological or something, you know?
Yeah, yeah,
Um,
yeah, true.
yeah.
But I guess for the unburdening
Yeah.
perspective, I just guess for clarity, it doesn't have to be some major trauma or something like that. It could be
Right.
I was quite a sensitive child and my parents were fully loving, but maybe they
Hmm.
weren't completely emotionally available, or maybe they had to do night
Yep.
shifts and I didn't see them that much. And I felt
Yeah.
really angry about that and couldn't express it. And now it's deep down
Hmm.
inside of me, that sort of thing. So, yeah.
Yeah. I like to say it's like emotional injuries that we take on because it feels, because we can take that on from like anything.
Yeah, exactly.
Even subtle things. It's really just about how our brain was perceiving something at the
Mm.
time, even if things weren't intentionally caused, you know, any harm or.
Yeah.
But yeah, when we're kids, we're vulnerable and we
Yeah.
are like our brain's not fully developed and we perceive things in certain ways and
Mm.
our brain just kind of like stays stuck sometimes in that state. What's what I'll say really, I'll not talk too much about this, but there's some theories out there now about how, well, something that neuroscience has shown is there's something called memory reconsolidation. I don't know if you've heard of that.
I haven't.
Um, but it really gets me excited because it's something they've found is an actual thing. Like they've really proven that to be something that happens. What hasn't been proven is like what therapies for sure are like helping that happen in the brain. But essentially what is happening in memory reconsolidation is it's helping the brain. You're unlocking old learning, bringing in new learning, and then that solidifies back down into this new learning. And so there's some theories about IFS going through the steps of like unburdening and like going through identifying all this stuff is maybe going through those memory reconsolidation steps. And that's why there is a shift that happens. But IFS isn't the only approach that people are theorizing do those steps. There's a lot of experiential therapies that do that. And sometimes certain therapies just do that by accident, even where they're not even knowing that they're helping a person relearn something. But yeah, I'd be curious to see if there's anything with exposure therapy. I don't know. I haven't dug into that. Yeah. So they're still working, I'm sure, on like researching that. But yeah, interesting stuff. Yeah, it's a really cool, I think, discovery for neuroscience. And I think that'll be interesting to see how that starts affecting the field of therapy and like the kinds of therapies we're doing. And yeah, I mean, hopefully there will be some more experiential therapies that will be shown to be helpful for OCD. I think it's happening. I think people are experiencing it, but it's just there's not a lot of research yet showing it directly. So
that's it. Yeah, and research moves slowly. So
yes, true story.
I suppose it's just down to funding, isn't it? Funding is abundant. Okay. Did you have another point on the merging of the two? I can't remember.
I know. I'm sure there is more, and I wanted to talk about more of that, but like maybe we need another podcast. Let's see. Yeah, I think we can still, I'll just kind of maybe reiterate a little bit. We can still do exposures and set up an exposure hierarchy. It's more of just, I think the IFS combination with it is just starting to help people have a mindset shift and relationship shift with their OCD as they're doing the exposures. I think when you have more access to that separation space between OCD and you, your deeper you can become this like comforting guide or person of connection to the parts of you that are scared and doing these exposures. And you can also like ask questions of yourself, like, is this okay to do right now too? Like, is this going to completely like obliterately overwhelm you? Or I think it's not about getting rid of the fear. Well, I don't know if I want to say it that way. What I wanted to say is that it's about befriending the fear and helping your fear learn like a different way. And, fear is like maybe another thing we can say. I'm just referencing OCD, but we can kind of think of fear. I like to say it's really almost the same thing as the OCD. It's like these parts are in fear. And so, yeah, befriending those parts or the OCD feelings inside, and then building up more internal trust even with those feelings. And yeah, really helping those parts of you face the fears. Just knowing that what it is, it's almost like this internal attachment. You can think of, they've talked about IFS being an internal attachment therapy. And so it's like you being this like internal compassionate attachment figure for these OCD feelings, as maybe these parts of you are learning that, oh, we can face our fears. We can do these gradual exposures. And I still have this like loving support inside to do those things. Yeah.
Yeah. Nice. So we'll take a bit of a detour here. So it's kind of not talking about parts here, but I guess aged parts of yourself. So you pick up the phone and call the 20-year-old you. What do you tell her?
The 20-year-old me. I have to think about where I was when I was 20. Yeah, I would say I would just let that part of me know that it's okay to make mistakes. So I think that was kind of like right before going into the career field and like
Mm.
diving into that more, and when a lot of my OCD symptoms started to develop. And it's okay to make mistakes.
Yeah,
Yeah.
absolutely. Absolutely.
Yeah.
And of course, that's a compassionate message.
Of
Um,
course.
so you got a billboard in Minnesota. What do you want written on that billboard?
Yeah, that is a good question. I would say, yeah, the billboard can literally just say, be kind and gentle to yourself
Mm,
or with yourself.
yeah. Okay. Nice. And lastly, is there anything else you wish you could have said or shared today?
Oh, probably. Um, but I would maybe just ask people to maybe consider how it does might how it might start to feel a little different when you start to think of OCD as possibly being a
Mm,
protective um, part that's just really trying hard to help you through your
mm,
life and manage pain and vulnerability, um, uncertainty, which is a big thing with OCD. Any parts of you that have a hard time holding that uncertainty. Yeah, it's a protective part of yourself, and just being able to see that, just consider it and see if there's some more compassion that comes and more curiosity that comes around that just from that
mm.
practice. But
Yeah. Nice.
yeah,
Nice. Well, good way to end. And no, thank you so much for coming on talking about IFS and also in combination with ERP.
uh,
It's a topic I wanted to cover for a while, so thank you.
yeah, it's exciting. Yeah. Oh, and I will
Yeah.
say, if people want a little bit more information on like how to, I guess just some clearer information too on IFS therapy, there's a really good like YouTube series called What is IFS Therapy? And that's by Dr. Tori Olds. I just feel like she does a great job of explaining some of this. So if anyone has some curiosities about that, yeah, we can look that up.
Nice. Yeah, I'll put the link in the show notes.
Yeah, there you go.
Yeah, so thank you.
Yeah, thank you. It's great.
Thank you for listening to this week's podcast. If you enjoy the OCD Stories podcast and would like to support us with a one-time tip/donation, please go to theocdstories.com/support. All tips, no matter how large or small, are greatly appreciated. Please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. If you want to find out more about NoCD, head to go.treatmyocd.com/the-OCD stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.